but it's simply a modification of a medical savings account in which people set aside savings, as we used to in the old days, up to a reasonable amount, $3,000, $5,000 a year. Now, the employers can step in and make that payment an escrow account to their employee, but that's a holdover from the World War II days when they couldn't raise salaries, when there was a government fix on prices and salaries. So in order to recruit employees away from another war industry, they couldn't offer them more money. They'd offer them health care benefits. So it was a loophole, and now we're stuck with that. But it is part of the entitlement picture. Most of AFIIG-CIO people don't really realize that that's their salary that's going out the window. If they had it handed to them, they could very well pay a medical savings account and keep what's left over for themselves.
Thank you. Do we have another question from the audience?
Sadie Zamora, and I'm speaking on behalf of the youth here. What I have to say is I've heard a lot of people make the argument that the major issues in our country, such as healthcare, aren't going the way the majority of our country wants because a lot of people choose not to get involved. So I'm presenting the question, as a youth in our community, what is my incentive to get involved? How do I know that the people making the decisions for our country actually know what they really deep down believe and think is right for our country? Because we see a pattern of sinking deeper and deeper. And how do we know that the people making the decisions know that that's the best thing and this isn't just beliefs and views that are passed down through generations in their family?
Good question. Dr. May?
That's a good question, and if I can repeat it, you're asking how do we know the people we elect know what they're doing? And well, that comes down to we the people. And as I mentioned before at the start of this second session, we need to get out there, we need to educate ourselves, we need to educate other people, we particularly need to educate the young people. Right. I sat in on a small meeting about 5 years ago. I was asked by a group of people in the U.S. House to help them put together health care policy. And I said, why do you need me? You've got all these think tanks up here. And they said, well, we really can't get people to communicate with us, and besides that, our staff really doesn't want to listen. And what was told to me by the people I met with, they said, you know how we're handling Medicare and health care up here? They said, all we do is, it's all knee-jerk. We put Band-Aids on it. That's right. And that's what it's really been pretty much up to this time. Now we've seen a sea change, and it's not just about putting Band-Aids on it. It's just not about putting quick fixes on. What we're seeing right now is not really about health care, as I said before. It's just a power grab. That's the whole basis of it. I don't think the people pushing this really care about us, about patients, about health care. It's just a means of getting all of this quickly under the government umbrella, and once they do that, then they're going to figure out what they're going to do to us, not for us.
Thank you, Dr. Miller. Ms. Ashmore?
I would like to add, I think that there's a lot of representatives and senators that probably believe they are doing the right thing. And as with a number of members on this panel, I became very intrigued by the political process way before the experience with my mom. And kind of going to your question directly about how do I get involved and what kind of difference can I make, you almost turn into a ledge junkie. And you read all the bills, and you start looking at the words and the implications of the words. And it's so critically important in this debate right now for us to understand the terms that are coming at us. Because you talk about putting lipstick on the pig, it is being done. And people do not understand the very subtle differences because they haven't read even the summaries of the bills. I wouldn't wish a 1,000-page bill on anybody. But you can get a really good feel for the general gist. and the taxations and the penalties and the words that are used by reading bill summaries. Then when you call those legislators and you go to town halls and you write letters and you talk to your friends and neighbors, you are highly educated on the issues. And that's the most powerful thing that you can do. And for you to ignite that interest at this stage, power to you. We need you. What can we do to help?
Okay. Dr. May, would you like to follow up on
I'd
that?
like to add one more thing to that. We are very well represented, as Mrs. Ashmore said. We have in Congress Representative Nargebauer, in our Senate, Senator Cornyn, Senator Hutchison, and at the state, one of the great things is we live in the state of Texas, and as Governor Perry said, if this goes through, we're going to pass legislation here in the state of Texas to ban what the federal government is trying to do to us. We're going to start asserting our 10th Amendment rights and just saying no to the federal government. You can't do this to us. This is people's rights, and this is states' rights, and the Constitution of the United States of America doesn't allow you to do that to us.
Thank you for that. Next question, please.
My name is Jacob Holt. America is already billions of dollars in debt, and if they pass this health care bill, how much money do you think that would cost, and how would they pay for that? Will they be taking money from me through taxes as I grow up and try to go through college? How are they going to be paying for that?
Every way possible, they will try to pay for it. They will increase Medicare payroll taxes. They will increase Medicare premiums. They will increase regular insurance premiums. They're going to have to increase not only the high-end income taxes, but anybody in this room that thinks that not every spread of income tax bracket is going to be hit has got your head in the sand. And I have two girls, one 32 and one 35, and I have 4 grandchildren. And I'm sure that others have got a great legacy up here as well. I'm scared to death for their capacity to be able to have a future without being so burdened in tax levels and levies and fees and fines every time you turn around that they can't get ahead. The real problem is, and my kids have already told me, they're just going to put me in a home. They're very loving children. There's an issue we haven't discussed tonight that kind of directly goes to your question about how we're going to pay for this and are you going to have a chance?
Let me underscore something. I'm going to read something out of this article, and this will give you all a perspective. You know how they have on the internet what stacks of money look like that are $1 million,
right,
and $1 trillion and whatnot. And so it gives you a perspective that you can't grasp really on your own necessarily. And so here's what Mr. Goldston said here. If you took every bit of profit from the greedy insurance companies, every dime, you would pay for 4 days of health care in the United States. If you took every single penny of profit from Big Pharma, you would add 7 more days of health care for this country. That's 11 days. If you took the combined profits of every freaking company, your small business, big business, the university, the med school, Covenant Hospital, every business in every city of America, you pay for 5 months of health care. So, to the young man asking,
right,
who's going to pay? You are,
right,
buddy. You
right.
are.
By the way,